Hello everyone again. My name is Alexis Reyes and I'm going to be talking about adventure therapy. So, adventure therapy in the field of therapeutic recreation encourages people to seek treatment in adventure activities. So, these activities range from simply standing on a flat piece of wood, which is the facilitation technique that I chose at the end of this video that I'll show you guys, to climbing ropes several feet off the ground. Adventure therapy can really challenge individuals in a different way than other activities and therapies. So, adventure therapy, according to page 14 in our textbook, refers to the subset of adventure programs that focus on the use of adventure activities to accomplish treatment-related goals. Adventure programming is the promotion of interpersonal and intrapersonal change with the participants. And adventure activities range from camping, kayaking, canoeing, rope courses, to base jumping and zip line tree canopy tours. So, adventure therapy gives people the chance to really put themselves out there and challenge them. Adventure therapy is a sort of therapy that people look at and think, wow, like, I don't know if I can do that. But once they do it, then their perspective has changed. Now I'm going to be talking about the history, the description, and the purpose of adventure therapy. So the adventure experience paradigm, components of adventure therapy, and metaphoric learning are all there to help explain the growth in an individual that happens in adventure therapy. The adventure experience paradigm gives individuals a learning experience because of their perception of risk and competence that creates a challenge. The components of adventure therapy gives the individuals a chance to learn and to reduce their thoughts that make them think that they have limitations. The environment and social group is so unfamiliar to the individuals, but the setting and people provide an overall great experience for them. This experience includes a cooperative environment, problem solving, feelings of accomplishment, which can lead to an increase in self-esteem, self-perception, and pride, and increased awareness. Lastly, according to Groff, metaphoric learning occurs as the group or individuals discover that strategies required to complete adventure activities are similar to the strategies that they could employ when faced with similar challenges. Now I'm going to be talking about the history of adventure therapy. So, the history of adventure therapy started with tent therapy in 1901, which had participants live in a tent for a whole summer. There was therapeutic camping, which taught sailors how to basically survive to deal with their hardships. Lastly, Outward Bound is a wilderness program that helps individuals with the development of life skills. The activities in adventure therapy can help a number of people, from mental disorders, multiple sclerosis, cancer, muscular dystrophy, just a number of things. Overall, adventure therapy is an active approach to therapy that challenges people and changes their perceptions and behavior in a more positive way. Now I'm going to be talking about theoretical foundations of adventure therapy. So there are 4 social psychological theories that explain the effectiveness of adventure therapy. The first one is self-perception theory, which according to Daryl Bem means we obtain much of the information that we use when developing perceptions of ourselves when we observe our behaviors. So an example would be if James got up on a surfboard for the first time, then he would think of himself as coordinated, flexible, and good at balance. So, like, think of it like this, another example, like with adventure therapy. So if someone did a rope course in their group, provided by their RT, then once they get to the top, they can reflect on how they did it and think, wow, now that I've done this, I am good with communication since I talked to my group and we got to the top, and I am, good with teamwork and other stuff like that. Whatever they think they learned, then they can reflect on that after they have completed their activity in adventure therapy. So when participating in adventure therapy, the activity gives the individual time to observe their own behavior. Lack of communication and cooperation in a group activity will result in not reaching their goal, which helps individuals modify their actions and behavior to correct the outcome. So if that person, didn't do well in their group, then their group ended up not succeeding. So they need to communicate again and figure out a better way to complete their activity together. The second is self-efficacy, which is a person's beliefs whether or not they are capable of completing a task that tests their abilities. So according to Bandura's self-efficacy theory, information gained through experiences that show the individual's capabilities are more of an influence in determining the person's feelings and self-efficacy. So since it's adventure therapy, unusual environments have a big influence in an individual and groups. So they will look back on that experience to evaluate their skills and capabilities. The third is explanatory style, which deals with learned helplessness and learned optimism. So explanatory style are the ways in which people explain their occurrences of events. This theory helps individuals construct more positive thoughts in order to recover. Learned helplessness is basically thinking whatever they do does not matter. And that's what we don't want the client, the participants to think about. We don't want them to think that nothing matters when they are trying to participate in their activity. What we want is for them to have learned optimism, which is the belief that they can come back from setbacks. The last one is self-identity, which provides the individuals with a sense of belonging and defining themselves. Okay, so now I'm going to be explaining the effectiveness of adventure therapy. There is a need for more controlled research for adventure therapy to understand the full amount that this therapy can affect people. There are a lot of studies on it, but there's not a large amount. Like, there needs to be more done so that we can find out more effects on how they are beneficial to people that are in these activities. So I'll be discussing 3 different studies about adventure therapy. In the book, Bowen and Neal reviewed studies that were specifically in adventure therapy. Overall, out of the 197 studies that they reviewed, they were mainly of male teens. Overall, the statistical outcomes were moderate positive changes in academics, behavior, family development, and physical abilities. The second is a longitudinal assessment on outdoor behavioral health care that was conducted by Russell. Even though parents said that there was a small amount of deterioration in the behaviors of the child, a random sample of the data collected revealed that the participants' outcomes continued to improve after a year after they participated in that activity, which I think sounds pretty good. So the third study done that I will talk about is a survey on the outdoor behavioral health program by Russell and Hendy. This study included adolescents that participated in the program. After a review of the program, they learned that these clients benefited and had positive outcomes. These positive outcomes included communication skills, cooperative behaviors, and social skills, according to page 30, if you want to look at it. The unfamiliar environment and lively atmosphere that is provided to people in adventure therapy gives people a chance to grow and have a chance to learn new interests. Adventure therapy has a purpose, and this therapy can help many people. Okay, so lastly, I will be talking about the implementation exercise that I chose. The communications activity that I'll be facilitating today will be called All Aboard. You can find this activity on page 34 of your textbook. This activity is typically used with a group of people, as you can see in my example drawing right here. You can fit up to 12 to 15 people on a 2x2 piece of wood. This activity builds communication, trust, and teamwork with the individuals and group. The leader, which would be the RT or TR, places a raised piece of wood or a flat piece of wood on the ground. Whatever is available to you will work the best. You just need an area that the people in the group that are participating can step on or be in to be able to do it. None of the participants are allowed to step off the piece of wood or be outside of that area. Depending on the leader, they will determine how long the participants will stay on this piece of wood. As I've seen in other videos, they have made it more fun, and they made the participants sing a song while holding each other to stay on this little piece of wood or inside a circle that they made small. And it seemed pretty fun, and it made a bonding experience with those groups. With this exercise, I'll only be doing it for 5 seconds as stated in the textbook. But if you are facilitating it yourself as a professional, then you can do it as long as you want, and it will create a bigger challenge for that group. The disability that I chose to be working with is cancer. And now I'm going to be facilitating the activity to 2 other people. Alright, hi you guys. I'm going to be facilitating and showing you guys an example of how to do the All Aboard activity. Like I said, it's on page 34 if you want to see it again. So we will start by introducing my participants. I don't have a lot of participants, only have 2. So we're going to start by introducing Alex and Elizabeth. Thank you for coming out. So we are going to be standing on this piece of wood here, and you guys are going to be bouncing on it for 5 seconds. If you guys step off, then we are going to start over again, and then I will let you guys do it again until we succeed. Okay? Does it sound good to you guys? Alright, that's good. Now we're going to start this activity. So
let's do this.
Hope you guys enjoy. Okay, you guys, I'm going to show you an example of how to do All Aboard exercise activity. So here we go. So Alex and Elizabeth, are you guys ready? You guys are ready?
Yeah, we're ready.
Okay,
Yeah, ready.
So great. So can you guys step on that piece of wood and we'll get started. Okay, now I'm going to count to 5. Okay? So 1, 2, 3, 4, 5. Great job, you guys. Okay. So, do you guys want to talk about
Yeah, I think this
how it was?
experience was really great because I could actually do it. I'm not really good at balancing.
Yeah, the activity was great. I just think that would have been more challenging if there's more people. Thank you guys for watching.